body to even grow that material more efficiently. And that would be rehabilitation. Right? It's not necessary, but it's highly advised. In other words, if you had knee surgery, would it be a good idea to rehabilitate afterwards? Yeah, I think so. So here's a 43-year-old lady with debilitating right knee, no history of specific trauma. Over the course of 2 years, the knee pain worsened to a point where not being able to climb stairs, had to climb stairs sideways. Anybody been there? Yeah, me too. They couldn't get out of the car without almost collapsing in pain. They had to stop exercising for 6 months due to pain, and ligament tears were noted in the knee joint. So she got injected. 1 week after, she was able to run up and down the stairs with minimal pain. 4 weeks later, patient describes as 80% better, could do a squat with almost no pain. End of 2 months, describes 95% better, able to return to exercise, pain-free running, squatting, lifting. No guarantees in it. You know, one of my colleagues is an orthopedist down in Texas. He's this short little guy with his cowboy hat on. And he talks with this southern drawl, and I asked him, I said, Dr. Bjork, and he's been an orthopedist for 20-some years. He doesn't do orthopedic surgery anymore. He just does stem cell regeneration. He's done more than 600 injections. And I said, Dr. Bjork, what do you tell your patients that have severe hip degeneration or severe knee degeneration, what they can expect for a response? And he says, well, I'll tell you, Dr. Cooper. He says, I tell them, you can expect anywhere between 0 and 100%. You'll probably fall somewhere in between. And that's the truth of the matter. I'll just say, this organization that I'm associated with, clinics are claiming 90-95% significantly positive results. And I would say that's our clinic too. We fall right in line with that category. So far, everybody's responded positively. Some people might come in and expect that I'm going to have a brand new knee joint and I'm going to be able to do all these gymnastics and things. That may not be the case. But if you're looking for pain relief and good function, this is the chance that your body needs. And if you want to avoid replacement surgery, this is the chance your body needs. So this is Colleen. She's a physical therapist. She had debilitating bilateral knee pain, numerous dislocations. She had a genetic defect that caused her to have more than 20 knee dislocations over her young lifetime. They'd recommend arthroscopic surgery at age 22, told she would need a knee replacement in her 40s or 50s. She did rehab, she did nutrition, glucosamine and chondroitin sulfate, chiropractic, HA injections. For the past 30 years, she could not sit crisscross, wear high heels for more than a couple hours, run at all, difficulty going up and down stairs, and couldn't do a squat. She got injected. She also had mild inflammation in her knees the week after. 4 weeks after, able to wear heels for 2 days at a conference, do a full squat, and get a case of water to the bottom, at the bottom of a shopping cart. 5 weeks after, the patient describes 95% better, started running, pain-free squatting. She says, it's strange not having anything bother my knees. Before I forget, I want to say something about cortisone injections, so that, because we've had people come through here and they're desperate for relief of pain, and then they come into our clinic, but before they came into our clinic, the week before, they got a cortisone injection. So I'm not telling you not to get a cortisone. I'm not trying to get in between you and your providing doctor. I'm just saying this. We can't do amniotic allografts for 30 days after you've had a knee cortisone injection. And here's the reason. We need the inflammation in there. That's how these cells work. They find the damaged area and they want to go repair it.
What about the Easter foam?
No problems. No. Any problems, Dr. Dixon?
No.
No. No. So we even have people stop non-steroidal anti-inflammatories for the week before and then not take them after. We have, if they need to take Tylenol, that's fine. It's not a non-steroidal. But we want the inflammation. We don't even have people ice afterwards. No ice. We want that inflammation there. We want that inflammation working to draw in and have the signaling messages for these amniotic allografts to actually go to work. So here's the physical therapist. You can see in July of 2016, not very good right there. Can you see that? Right? And about 9 months later, you see how this has began to open up here? Right? So that doesn't just happen by accident, and that's not trick photography. So here's another person. Lots of arthritis in this knee. See these spurs here? This would be called bone on bone, right? But it's really a tortilla, not a pancake. Now look at that. So the other thing, do you see how the angle of her knee here and the angle of her knee there? See how that's changing? Barbara, the one that did the video testimonial for us, has also noticed her knees changing. How did we do that? We had her braced because she was also knock-kneed, and we braced it, very comfortable braces to wear, begins to offload that knee joint and begins to give that knee joint some space for those amniotic allograft cells to work.
What will your last 10 years look like? Will you be quick enough for a game of tag with your grandchild? Strong enough to embrace every moment? Will you grow old with vitality? Or get old with disease? It's time to decide.
So the advantages of taking a proactive approach, we had talked about that earlier, proactive approach to your health compared to a reactive approach. Saves money, saves time, improves quality of life with family, friends, grandchildren, and many other things. It's all individualized. So what are your decision options? Do nothing. That's a decision, to do nothing. You have physical therapy. Who's had physical therapy? It's a great idea to have physical therapy, right? We're going to suggest rehabilitation therapy after our procedure too. But now you've got the regeneration combined with the therapeutic exercises to make this a more permanent solution for you. You can get cortisone injections, but you know they're numbered, and you know now tonight every cortisone injection damages tissue. Can't happen any other way. You can do the high hyaluronic acid, the Rooster Comb injections. That does buy you a little bit of time. You can do surgical joint replacement. There's problems there. Sometimes people do really well with that, but oftentimes they don't. Or this breakthrough treatment approach that uses the body's own healing ability to repair and regenerate damaged joints and tissues. So again, there's the cost of replacements, for example, and out-of-pocket expenses. National average is $4,000 to $8,000 with the amniotic allograft. Our clinic is $4,450, and so our lecture price, our seminar price for the next 30 days is $39.50, so you'll save $500. Sometimes people have to have the other knee done. We drop that fee down to $29.50. for other joints. So here's what I'm going to offer you. If you're interested, fill out this form here. Also fill out a release of records form. We want to get those imaging studies in as soon as we can. We can take imaging studies at our clinic, but if you've got them already, let's look at them. Then we don't need to take any. Your complimentary consultation is not an exam. It's meeting with me to see whether what we offer you might be a good fit or not, and whether you would be a good patient for our clinic. Prior to the first consultation, you need to fill out some forms before you come in. So that's this form here. It's a history form. We want some medical records, x-rays, MRIs, surgical reports, anything that you've had. If you qualify, we can then set you up for a focused exam with our medical staff, Dr. Dixon. There is a fee for that. It's a $97 fee. Insurance doesn't cover it. It's a focused exam that generally takes half an hour to up to an hour, depending on the condition, how many joints are involved, that type of thing. We need to make sure you qualify to be an amniotic allograft patient. Second consultation you'd come in for, there's no charge for that. What we do is we go over an action plan. You decide if this is a good fit for you. We've already made the determination that we can help you. If it's a good fit, if you qualify to be a patient, if it's a good fit, we go over the finances in detail. We've got many different payment options, and we can make this program affordable for anybody who has the desire to try the therapy and to begin regenerating their damaged joints. Okay. So, does anybody have any questions? Yeah.
Okay, so heard good results for the first year, and it's in there regenerating tissue, right?
Mm-hmm.
So, I mean, if it regenerates tissue, should be nothing permanent, but it should be
It's improved.
Okay, but how often do you have to come back in? You come in a year, does it then after the first year start degenerating again?
Generally, people need one treatment. The jury is still out. For example, for myself, I had it done 3 months ago. I'm still continuing to see improvement. I'm not, unless I re-injure myself for some odd reason, I'm not even consider having it done again. But
So
down,
the regeneration is permanent?
the regeneration is permanent, but then does your daily activity and lifestyle cause further degeneration?
Sure.
Do you have, let's just take a knee for example. Do you have compromised knee mechanics? Do you have knock knees, bow legs, whatever? If it's a hip situation, what kind of gait mechanics do you have? Can we begin to teach and reteach gait mechanics to help repair hips? Yes, we can actually do those kind of things. But it really depends on how diligent the patient is to the rehab, and are they going to continue these lifestyle habits for the rest of their life. You described your body as a temple. You actually,
It's a joke, but
yeah, I understand, but it is a temple. That's the reality of it. A lot of people don't treat it that way. We treat it as this vehicle we're driving around. In fact, most of the time we take better care of our car and our trucks than we do our own bodies, right? Why? Well, because if we let the truck degenerate, we know it's going to be more expensive, right? It's going to break down sooner. It's not going to be reliable for us. But we take for granted this body we've been given for our life that drives us around on this planet for X number of years so we can fulfill our purpose. What we try to teach people in our clinic is a wellness approach to the regeneration. The physical, exercise, flexibility, strengthening, etc. We also try to teach people nutrition if they're open to it, right? Because we know all of these things will help keep the body healthy. eventually the body runs out of juice. Eventually the body, the battery goes low, and we're off to the next adventure, whatever that happens to be. I'll leave it up to the theologians to describe that. But there's only so much energy left in the body. If we begin to take care of this temple as a temple, it's going to last us a good lifetime. And our quality of life is going to be so much better. So that's an important question that you asked. I don't have an exact answer to that.
Yeah, I get it. I get what you're saying. You gave me an answer. Let me ask you the same question in another way.
Sure.
How long has this clinic existed? How many injections have you done?
Okay. I've been a chiropractor for 37 years. This clinic has been in existence for almost 8 years. We just started I was the first patient. We've got 30-some injections under our belt.
So,
So far, great results.